I want you, yeah you, to do something good for your body, particularly your heart, for 10 minutes straight. Now the first minute of this video, I'm going to do a quick explanation, and the remaining 10 minutes, I want you to get moving while I provide you with motivation and information for a healthier heart. Get through the first 5 minutes with me. If you have to stop, then stop. But if you can keep going, finish it out the last 5 minutes with me for a total of 10. Now I want you to pick one of two activities and go at any pace with the goals of increasing your heart rate above what it is right now at this minute. At a later date, your goal is to eventually get up to your maximum heart rate. First, the disclaimer. Physical activity that requires moderate effort is safe for most people. But if you have a chronic health condition like heart disease, arthritis, or diabetes, also if you have been inactive and have a disability or overweight, be sure to talk with your doctor. Now here are your choices. 1. Simply walk up and down a flight of stairs, doesn't matter how many. 2. High knee raises at a pace to get your heart beating faster than it's beating right now. Get in place and let's get going. While everyone feels they should move more and exercise more, most feel like they just don't have the time or the ability to put in a full Olympian athletic effort into a workout routine. So they just do nothing. Now, you know you have 10 minutes. You had time to flip through social media or watch the news. You have 10 minutes for everyone and everything else. Take these 10 minutes for yourself, not for your nails or a hydrating facial treatment or a long relaxing bath, but for your heart. Take back these minutes multiple times in one day, every day, or every other day, but do it now and do it regularly. Your heart wants to exercise. Your heart needs it. Ideally, you can calculate your maximum heart rate for fat burning or just general cardiovascular health and attempt to get there. But you don't have to get there today, not just yet. But you want to get a greater heart rate than you are to sitting still, and you want to build from there. Baby steps, okay? Baby steps. Now, why does your heart want and need exercise? Because your heart is a muscle. Your heart wants the practice of pumping blood to the rest of your body. It doesn't want to constantly pump at the bare minimum of its ability, because then it gets out of shape to the point where when it really needs to get extra blood to your body, it's out of shape, it's stressed, it's struggling to meet your body's basic needs. Your heart wants to be in shape and ready for action. Now let's talk about finding your resting heart rate. It's best to check it in the morning after a good night's rest and before your coffee. You're going to feel your pulse. Well, how do you do that, you ask? Well, take your right pointer finger and your middle finger. Touch the middle of your neck and swallow. You feel that cartilage that just moved up and down when you swallow? Yeah. Place your finger there and slide your finger to the left and gently feel that groove. You should feel your pulse there. Using a timer, count how many times your heart beats in 30 seconds and multiply that number by 2. Now the average heart rate for an adult should be about 60 to 100 beats per minute. Your resting heart rate can be affected by things like stress or anxiety, hormones, medication, and how physically active you are. Athletes are more physically active, so they may have a lower resting heart rate. I've had patients who run marathons with resting heart rates in about the 40s, believe it or not, and that's normal for them. A lower resting heart rate is generally better. This means your heart muscle doesn't have to work as hard to get blood to your body and maintain a steady beat. A higher resting heart rate generally means you have lower physical activity. There are tables to find your maximum and target heart rates. Your target heart rate will depend on your age. The formula is generally 220 minus your age. Now, the American Heart Association recommends 150 minutes per week of moderate exercise. Now that's about 20 minutes a day. That's a great goal, but let's just take it baby steps for now. Let's just try to get through 10 minutes a day. Okay, are you still going? Are you still with me? Do you think you can get through the next 5 minutes? You're almost there. If you need to stop, stop. And I'll see you tomorrow. But if you can, keep going and we'll continue our talk. Now, in addition to a moderate cardio workouts, the American Heart Association also recommends at least 2 days a week of activity that strengthens the muscles. Now, if you'd like for me to put together a video of some basic exercises for strengthening your muscles as well, let me know down in the comments below. Subscribe to my channel and hit the notification bell so you'll know when I upload that video. Now, I encourage you to aim for the recommended activity level, but I just want you to be as active as you can be. This is so important because physical activity can help you feel better and sleep better. Even small amounts of vigorous physical activity can be beneficial in reducing anxiety and improving your overall health. Any aerobic activity can count. The key is to keep a moderate to vigorous intensity. Now that you're doing some activity, I want you to start thinking about, your diet. Now that you're starting this step, take the next steps. Baby steps, remember? Just make a commitment today to increase the amount of veggies in your diet. I do have a video showing you how to prepare delicious roasted veggies. You should go check it out after this. Are you sweating? Even better. Is your heart rate up? Excellent. I love it. I want you to hang in there. We're in the last 30 seconds. If you feel like you need to stop, go ahead and stop. And I will see you tomorrow, and we will keep working at this every day until you can get up to the full 10 minutes of this workout. Hang in there. Keep that motivation high. Keep those knees up. Keep that heart rate up. We're almost finished with the first half. I want you to stick around with me to the second half so we can go over more heart-healthy tips. Let's go. I want you to know that I was inspired to make this video by a coworker that I consider a friend. Her husband had a heart attack at the age of 52. Very fortunately, he's at home and recovering. Now, he obviously will have to take a different path for heart health. But my friend does want to change her life for her husband, for her children, and for herself, of course. There is somewhat of an urgency and for her situation to do so. So I thought about, where do you begin if you find yourself over 30 to the fitness lifestyle? You have a family, a job, and a shitload of things to do. It can be very overwhelming. So I wanted to make this video to encourage that to a healthier lifestyle and a healthier heart. Now, I acknowledge that there are many people who pretty much haven't run since their PE class in grade school. That's why I wanted to keep it very simple. Just start. Just make a commitment to start with me and do it regularly. I want you to eventually outgrow this video. I want this video to become too easy for you, and I want for you to find more challenging workouts. I just want to be the one who convinced you to start today. Now, I know these exercises may seem pretty basic and pretty easy. I'm a health provider. I'm not a fitness expert. My goal here is basically to motivate you to get up and do something and get your blood flowing, get your heart rate up, get your heart pumping, and basically improve the condition that you are in now. If you find yourself a little bit older and don't really like gyms and can't really get into any exercise programs, you can make it very simple and very easy for yourself. Like I said, I'm not a fitness expert. I have no idea on how to entertain you and how to make this fun for you. I'm just trying to make it simple and easy and something that you can do to get you started, and hopefully you can on your own take it to the next level. Now, these knee raises may seem pretty straightforward and easy. If you feel like you're not getting that much of a workout, lift your knees higher. Bring them up to your elbows. The higher you lift your knees with these, the more of the workout that you're going to get, because your quadriceps is a very large muscle group, and it's very good to work the largest muscle group of your body. So the higher you lift those legs, the more you're working those quadriceps, the more effort that it takes. You lift those quadriceps, the more work you're doing, the more your heart will pump, the more you will sweat, the more you will get a good workout. For the stairs, you can go at your own pace, but please do be careful. Watch your balance. Use the rail if you need it. So, how do you know if you're working out hard enough? Your workout is considered moderate if you can talk but not sing during the workout. Your workout is considered vigorous if you can say no more than a few words without having to take a breath. So let's get back to the details of heart health. Now, study after study has come out to show that a sedentary or an inactive lifestyle is at the top of the risk factors for heart disease. You're more likely to experience a cardiovascular event like a heart attack if you live a sedentary lifestyle. The American Heart Association reported nearly 255,000 deaths per year from complications of heart disease related to a sedentary lifestyle. So, how does exercise help you with heart health? Well, exercise helps keeps the blood vessels pliable, keeps them from getting too stiff, hard, or fibrotic. This enables good blood flow and normal blood pressure. And better blood circulation reduces the risk of developing clots or blockage in these arteries. Exercise also helps you control your blood pressure, and it does this by stimulating the release of nitric oxide, which keeps the blood vessels nice and patent or nice and open. Exercise also helps raises the levels of the good cholesterol. That good cholesterol is called HDL, and having a good HDL level will lower your risk of heart disease. We're closing in on the final stretch. Did you get your heart rate up? Are you sweating? Are you huffing and puffing? Are you going to check your heart rate after this? Well, I certainly am, and I want you to stick around to the very end to see how high I got my heart rate up. In the comments below, I want you to tell me what your resting heart rate is, and then I want you to put what your heart rate got up to with this workout. Good job, we're almost there. Keep it up, you did it. You took that first step. Play this video again tomorrow and the next day, and keep it going until you notice the difference. So now I want you to get ready. You're almost there. After this, I want you to grab a tall glass of water, and I will see you tomorrow. Don't forget to like, comment, and subscribe.